So thank you, Bronwyn, and look, we really appreciate the opportunity to come and present today, and we're really excited about discussing the research we've been doing with you over the last few months on the benefits and challenges of infrastructure investment in growth areas. I realise time is fairly tight, so this will be a fairly quick presentation, so do bear with us. Now, how do I progress my screen?
Okay, you sharing your slides?
Let me see. It's appearing in front of me. Do I need to do something?
Okay, just one moment.
Maybe I need to do an additional step.
There we go.
Okay, can everyone see that?
Yes.
Okay, great, thanks. On behalf of RMIT, I'd like to acknowledge the people of the Wurrung and Boonwurrung language groups of the Eastern Kulin Nation, on whose unceded lands we conduct the business of the university. So the presentation today is a broad overview of a report that will be released in the next week or so through the NGAA. So today it's a bit of a taste teaser before the full report comes out, but it's a real great opportunity to present on what we've been doing in the project and some of the findings and outcomes from the work we've been doing. So today we'll be going through the project purpose, looking at some case studies of new infrastructure investment in growth areas, presenting on the multi-criteria review that we've undertaken of a selected set of case studies, providing a summary of some of the benefits that we've identified through the work, offer some reflections, and also put forward some recommendations in relation to how Australia as a nation could do better in terms of its approach to provision of infrastructure in rapidly growing outer suburbs. So the project that we were commissioned to do by the NGAA was had a set of objectives. First was to understand the benefits of federal as well as state and other community and economic infrastructure investment in growth areas. The second objective was to look at opportunities for research to better quantify the benefits and to be able to record and measure the outcomes. Look for opportunities for agreed baseline data relevant to growth areas that can help with comparisons across various jurisdictions, and to inform decision-making for future investment and improve the policy process around growth area infrastructure. So what we did in the project was to work with the NGAA to identify a set of case studies that would, I guess, showcase the benefits of infrastructure investment, to pull together as much information as we could about those case studies and whatever data was available, and then review the case studies and identify the benefits and challenges that they faced, though focusing, I would say, on the benefits. And we also undertook a set of information sessions with councils who were host to projects that were case studies to get further information about the case studies and to tease out some of the more detailed aspects of the benefits that weren't necessarily recorded in formal documentation that was available or provided to us. So in terms of the research, we were looking at three categories of investment, and the case studies were sort of divided up amongst these categories. The first category was economic development infrastructure. So that was infrastructure that was aimed at either providing for jobs in growth areas or to enable local businesses or other economic actors to become more competitive or to grow their business or to become more productive. There were 5 case studies in that theme. And we also looked at community infrastructure, and this ranged across infrastructure such as libraries and cultural facilities, as well as health centres and sports fields as well, or sports infrastructure. So there were 6 case studies in that category. There was a couple that overlapped with economic development because of the makeup of the projects and the intent of the projects. And then we also looked at 2 transport infrastructure case studies. So the way we selected the case studies was that NGAA put out a call to its member councils inviting case studies to be considered through this project. We ended up with about 21 submissions across the NGAA network, which we then applied some selection criteria to shortlist down to a final set of 13 projects. Some of the criteria we applied were looking at the diversity of projects across those different sort of three categories, the extent of federal funding, and ideally we were aiming for projects where there was some federal funding given the overarching intent of the project. We were looking at impact and scale, so significant projects that had both a local, municipal, and to some extent even regional impact in terms of the services or the facilities that they were providing. Obviously, information levels were an important criteria. We needed sufficient information submitted to us that we could adequately evaluate the benefits of the projects. We're also interested in replicability and comparability, so projects that were kind of representative of a particular category and therefore, even though they're located in a particular municipality, would be broadly representative of similar kinds of projects that might be implemented across the growth areas in Australia. We certainly wanted projects that were well past the proposal stage and into implementation and construction, and ideally completed and demonstrating the use that the community was making of them. And then we're also interested in support that projects may have received from further partners beyond the local municipality or state and federal governments. So quite a mix of factors that we were working from here, but we're pretty satisfied that we've identified a really good set of case studies that really tease out and illuminate and highlight the benefits that this infrastructure provides to local communities. I can't quite see which slide I'm on because I'm about to hand over to Annette at some point. But I'll just run through quickly the selected projects. So in terms of the economic development projects, there was the Stretton Centre in Playford in South Australia, the new business station in Gosnells in Western Australia, and the Start North Business Hub in Hume. There are two, as I mentioned, that sort of overlapped between economic and community development. One was the Casey Fields sports field in Casey, which was principally a sports infrastructure, but it brought local businesses, including sports-related businesses, into that development. And also the Cranbourne West Community Hub in Casey. And then there was a whole set of community development projects ranging across different areas, including the Wallen Youth Services Hub, the Coburn Integrated Health Facility, the Regatta Park open space upgrade in Penrith, the Darius Wells Library and Resource Centre in Kwinana, the Sutherlands Park upgrade focused on a hockey field in Gosnells, and the Angle Vale Community Sports Centre in Playford. So both breadth of sort of categories as well as breadth of geographical scope. And then there were two transport infrastructure projects. One was the Bald Hills Freeway interchange in Mount Barker, and the second was the Evans Road and Hallam Road upgrade in Casey. Well, so I think, is this, Annette, where I hand over to you?
Yes, that's right. Thanks, Jago.
I've run through the slides a little fast there.
Yep. I think one further. Yep, that's right. So although we would like to present all of the case studies because they're already interesting, we don't have the time for that today. And I just briefly wanted to show you how we have presented the case studies in the report before I go a little bit further into our analysis. And so really in the report, so first we'll start with the community profile. I've given you here the example of the city of Playford and Greater Adelaide, really mainly showing, well, what is the population, what is the forecasted population, different population characteristics like how old are people, etc. And then also the share of the metropolitan population, how that has changed, and in comparison the share of metropolitan jobs, just to really show what does this community have. And then we also have some information on a social infrastructure index from the Australian Urban Observatory, which I talk a little bit more about in a minute. Could you put the next slide on, please, Jago? Jago. Fortunately, I can't progress them, I think. Thanks, Jago.
Having some difficulties with the slide. It's not moving forward.
Oh,
There we go.
okay, great.
it-
Thank you. Yep. Then there is a project descriptions. I've just put the first sentences of the Stratton Center here because I think, well, we'll talk about that a bit more a little later. So we'll have a brief project description, the report with a photograph. Then next slide, please. And so that's the social infrastructure index. So we have a map of this infrastructure index from the Australian Urban Observatory, which is an index of 16 items all related to social infrastructure, such as community infrastructure, health infrastructure, etc. These are maps which really show the comparison to the national, the national average in a way. So you can see if you're in the lowest decile, it's a dark red color. If you're in the highest decile, it's a dark green cover. And we've just shown that for each of the case studies. And yep, so for the home suburb and then also the LGA, so that you can see well. And as you can see on the little Adelaide map, it's quite impressive to see the red on the outers, in the outer areas and the green in the inner areas. Next slide, please. Oh, and yeah, maybe just for the people interested, I've put a link for the Australian Urban Observatory, but we can also send the link around later, just if you are interested in a few more of those maps. Then in the report, we'll talk about project objectives, business cases, and programs offered. I haven't put all the text here because that would have been too much. Then talking about funding and governance. So how was the project funded? In the case of the Stratton Center, for example, here there was 11 million from the federal government, 4 million from other stakeholders. And then really we come to our results of the multi-criteria review, the benefits and outcomes. So that's the presentation in the report. Next slide, please. And I'll talk a bit more about the multi-criteria review now. So what we did, we considered, well, a number of criteria, and these really came out from the analysis of the data and of our conversations with the councils. So these are really criteria or benefits that showed up in more or less all of the case studies, and we analyzed how the benefits turn out in those projects. So we have the health benefits, which really, for example, looks at physical activity, but also mental health benefits, community cohesion, which is about really a sense of belonging or social interaction. Does the project, for example, help people to come together? Social equity is really a lot about spatial equity in a way, so improved access in comparison to inner and middle suburbs, but then also maybe a focus on certain groups in the councils. Economic development is really about how businesses develop in the councils and how this impacts business overall in the councils. Employment relates to jobs, and then networking and connection is really about how does council, but also other stakeholders, how do they work together? Has the connection improved? Has networking improved? And I'll now go quickly through, unfortunately, quickly through the results from the benefits. Next slide, please. So I'll start with the health benefits. And as I mentioned before, this is really a lot about physical activity and also mental health. So I can't see the next slide yet, Jago, but yeah. So I'll just keep talking. Oh yeah, some caveats before I start with that. Sorry. Jago mentioned a little bit of that before, I think already. So what we found really when we were looking at the case study, that the data collected is very diverse. This really depends on reporting requirements, of course, also on the project. Sometimes the data is not publicly available. For example, if it is in a business case, they often are not available to the public. And some of the data is also not recent enough in a way. I mean, you all know growth areas grow really fast. So sometimes data that is 3 years old might already be not presenting the current situation anymore. Then some benefits are easier to measure than others. So some are quite easily quantifiable if you, for example, look at job creation, but then others, the impact of counseling, for example, is definitely more difficult to measure. Some of the measurements are proxies, which do not necessarily convey the whole situation. For example, again, direct job creation shows that there are jobs created, but it doesn't show where, or maybe if there is a diversification, or what other benefits came from this job creation. Then often it's actually difficult to understand or to even to prove causality. So really where, again, if jobs were created, or if maybe, so for example, if in a broader area, for example, jobs go down, but actually maybe jobs might be created by the business hub. So you can't really understand what is the causality, what is the broader spatial level, or what is the broader range of influence. So that's sometimes difficult to show. Then many benefits are long-term rather than short-term. So maybe the benefits haven't shown yet if the project isn't too old. And then some benefits may really be only understood through qualitative and more in-depth research. Again, if you're looking at counseling and how that impacts people, you can count how many people have visited counseling, but you really only understand the impact if you go a bit deeper. So that's the caveats before I delve into our results. And could you put on the next slide, please, Jago? So yes, great. So the health benefits, as I said before, this is really about physical activity, but also mental health, access to healthcare, also improved access to green open space. So everything really which helps people move a little more, people having access to counseling, to earlier treatment and prevention. So, and we found quite a bit of that here in the case study. So for one thing, you reduce travel time because local access has improved. Again, this is one of the ones which might be difficult to quantify, but actually if people don't have to travel as far, the work-life balance might be improved if their jobs are closer, but also they don't sit as much in the car. So that impacts positively on their health. Similarly, with improved active transport connections, so if people actually walk and cycle, they have more physical activity. Similarly with sports grounds, so if there are new members who can access those sport grounds, they have increased physical activity, but there's also informal recreational activities, so people go for a walk around those sport grounds, also being more active. Then, yeah, the improved access to healthcare, I mentioned. So if there's earlier treatment and that actually helps prevention. So and that also helps better integration of health and counseling services, and yeah, positively impacting on the health of residents. Improved access to green open space. That's again physical activity, but it also influences mental health, as research has shown that actually green open space impacts positively on mental health. And then, well, relatively simply, but if the transport connections are better, there's also an improved access of emergency services. Next slide, please. Community cohesion. So this is really about people meeting each other, facilitating social interaction, increasing social connection. And that can happen through specific programs, which are, for example, offered in the community hubs. For example, reading programs for children, but maybe then in the sports hubs also sport programs focused on women. So these are really specific programs, and that, yeah, as I said, facilitates social interaction, stronger sense of belonging. That also happens just to having a local hub where there might be a library in there, but there might also be a cafe. So people meet each other. So that's really one of the big benefits of those hubs. The sport programs also increase social connection. And then the counseling service, for example, can increase the potential for social participation. So people who are participating in counseling may be more prepared to actually participate in social and economic life. Then there can be a better reputation through this hub, which contributes to like local pride and sense of belonging. And again, the new and improved connections again help that people can easily more easily meet each other. And in some projects, we also have the consultation with community, which increases, again, the feeling of community. So, for example, I think it was the Angle Vale Sports Center where there was actually a consultation with the grassroots club. So this all helps to improve community cohesion. Next slide, please. Social equity. As I said before, this is really a lot about spatial equity. So really the improved access to services levels the field in comparison to inner and middle suburbs. And that's in a range of services, health, sport, employment, etc. So that's really where it helps. The other thing is also that services are actually better accessible, at least by transport modes other than the car. So people who don't have access to a car can more easily go to those services. And so they don't have to travel for 2 hours by bus maybe. And that makes it easier for them to access those services. There's also an improved gender equity. Some of the programs that were in the case studies had a specific focus on women. For example, some sports programs, but also women are sometimes less mobile in growth areas. Again, for example, because they don't have access to a car. So that also improves gender equity. And then again, more local jobs level the field in comparison to other areas. And then really catching up with transport demand. So that improves the congestion and amenity in those areas. So that also contributes to social equity. Next slide, please. Economic development, that's a lot of text. I apologize, but that is really about the improved knowledge of local small businesses. So giving them skills, but also access to other businesses, decision makers, through that helping the potential for diversification of local business, and also just giving them a location where they actually can work from. And then similarly, it's improved skills and economic participation of the local community. So also giving them new skills, but also through counseling, improving their economic participation. And then the third part is really the impact on local businesses through attraction of visitors, for example, through regional sports events, but also through more potential customers because the accessibility of the region is better. And yeah, supporting hospitality industry, for example, in those local centers. And a more specific one, actually, there is a better economic outcomes for sport clubs due to the higher membership. Next slide. So employment, this is really one thing is the creation of jobs through the business support. So in the business hubs, or all of the business hubs that we analyzed actually reported that they have created, or that their network members have created jobs. So really the business support leads to creation of jobs, again, to diversification of employment as well. Then, of course, you have the jobs for the respective case studies, people working in those hubs, working in the sports centers, etc. And then again, also improved access to jobs due to better connections. So jobs in other areas might be better accessible, but then actually also the improved access to local business also helps them to find employees. Next slide, please. The final, the final category. Networking and connection. And yeah, as I said before, this is really about improved interaction between councils and other stakeholders like community, local businesses, sports clubs, but also cross-agency collaboration. So networking between the businesses and between service providers. So that's what really has happened here. A lot of those, for example, community hubs, they're co-located, or also the Coburn Integrated Health Facility. There is their health service that are co-located, so they are working together more closely. So that's what has improved. And also in the community hubs, a lot of co-location of services has happened. The other thing that councils actually reported is that there is improved perceived accessibility of council. So in a way, because they're sitting in an iconic building, a specific center, people rather go there and have contact with councils than if they would just think, oh, I'll go to the council building to just do something I have to do. So that has also improved. Yeah, next slide, please. So just to summarize really, or to reflect better to say, on what we found in the case studies after that brief overview. So there's a broad range of benefits overall the case studies, which is of course because they're different projects. So some is more related to health, some is more related to economic development. But what is consistent across all of the case studies is really the spatial equity, where the improved access to the specific service has helped the residents a lot. So that's really one of the big benefits. Then the benefits have a particular impact on fast-growing communities. With that, we really mean a community hub would have similar benefits in a middle suburb, but because fast-growing communities, they're growing fast, they don't have the services, so having a hub there has a way bigger impact because there are not as many other hubs around. And in that case, also the early provision increases the benefits, meaning that if there is a center or a hub or a sports ground, when people move in, they can benefit from them straight away and don't have to wait for 3 years or to travel for 3 years to go elsewhere. The infrastructure gap is really, so although a lot of investment has happened, there is still an infrastructure gap. And what we really found is that there is a need for a national effort, just because there is such a big extent of these challenges. And because you can see it's over the whole of Australia, so it doesn't mean, or it's very unlikely that this is because of weak state frameworks or inadequate administration or any local problems, but that this is actually just, it is a national challenge. Next slide, please. So further reflections. So we had a focus on federal funding and also state funding. And really what we found is that the funding definitely supported or definitely enabled the project to proceed. So a lot of the project wouldn't have happened without the funding or would have been delayed for quite a long time. So it's very helpful to have that funding. But a lot of the funding comes from different programs. So really councils have to go and look, we want to implement a new infrastructure, a new sports infrastructure. What funding can we find? So that's why there was a bit of inconsistent funding availability between the case studies. And there's really no specific federal program for fast-growing councils, which would probably be helpful for them to actually have a specific focus and say, we need this infrastructure, we could go there. And then finally, data availability. I talked a little bit about that before. It's really at the moment difficult to compare case studies just because data is collected differently, and also because, so it's difficult to compare, but also to understand the causality and to quantify some of the benefits. And as I said before, growth areas change fast, but data is slow. One of the things that we could imagine from what we have seen in the case studies is that there would be an opportunity to collect standardized data from projects that have already been funded, collect the benefits and use these insights for future projects. So rather than trying to find the same quantification of benefits for all of the case studies, use projects that have already been implemented and understand their benefits. Okay, I think so. I'll hand over to Jago now for some of our final recommendations, which we got out of this analysis. Thanks.
Great, thanks very much, Annette. And look, I realise we're running up against time, so I'll probably jump through these pretty quickly, but happy to take Q&A on them. So I think, although it wasn't really an anticipated purpose of this project, what came out of the various issues that Annette has described, particularly those issues around funding programs, funding frameworks, and also data, information, and analytical models for analysing growth area infrastructure benefits, is that there's quite a gap at the national level in terms of both the provisioning and funding of infrastructure, but also the knowledge base around it. Because all these infrastructure types are developed by local councils, there's not particularly good systematic national level information that's available. And so we've got 4 recommendations coming out of this project. The first of which is to establish a national growth areas framework. And when we say national, we mean that the federal government, in collaboration with the states and local governments and territories, obviously, should establish a framework to understand and provide for infrastructure in growth areas. In order to do this, there should be a National Growth Areas Infrastructure Fund that involves dedicated federal funding along with identified state funding for growth areas. We need some good standards in terms of the level of infrastructure that's expected in growth areas, along with improved assessment models. And in our more detailed version of these recommendations, we talk about the Infrastructure Australia assessment models and cost benefit analysis and so forth, which could be not necessarily applied to, but perhaps adapted to better understand and provide for growth areas infrastructure provision. And also we identify the need for improved national coordination arrangements between the federal, state and local governments, and propose not necessarily the creation of a new agency, but that an existing agency be tasked with providing for that coordination of all of these issues. So we'll finish there, recognising we're pretty heavily into the time frame we had available to us, but we're happy to take any questions you might have. Our email addresses are there if you'd like to follow up. So I'll hand over back to Bronwyn.